So 1 year ago, I don't think anyone in here thought that we'd either had the first junior doctor strike in history, or that we'd have the BMA leading the trade union movement, or that we'd have doctors outside Parliament chanting Tories out. So we're realising that we can't be apolitical because it's not in the public or in our patients' best interests. But what has become apparent more and more are the issues that the NHS faces that this contract won't solve. So we've got the best healthcare system in the world for quality, for efficiency and for access, and that's despite the government constantly underfunding it and understaffing it, as well as overstretching it. So imagine the kind of healthcare system we could have if it wasn't constantly under attack and it wasn't constantly just hemorrhaging money into private companies' pockets. So the NHS today is unsustainable, but that's not because a universal and comprehensive and free at the point of entry healthcare system can't work, but it's because governments have introduced massive companies such as Serco to a market that's biased against NHS hospitals. They've put in legislation and policies that are putting NHS hospitals into billions of pounds worth of debt, and they're constantly attacking and demoralising NHS staff, and they're constantly running a smear campaign for the public. So junior doctors have seen all of these effects for years, but it's taken the politics and the discussions that we've had throughout this dispute that have given us the information and the motivation and the confidence to speak out and to stand up. So I know I don't have any faith in a government that will attack victims of domestic violence, our elderly, people with mental ill health, people with disabilities, people already living in poverty, or any other potentially vulnerable group, before we claim the tax that our millionaires and billionaires should be paying to our state and our NHS. And so every day we see the casualties of the inequalities in our society, and that's kind of the backdrop on which this dispute is set. And it's a dispute that's just full of hypocrisy. So Hunt and Cameron speak of 11,000 excess deaths at the weekend, and they're wrong for many reasons. But also, if they really cared about excess deaths, what about the 15,000 people who died last winter due to fuel poverty? Or the 2.5 million years of life we lose each year due to child poverty? Or the fact that 2 children are drowning in the Mediterranean every day trying to reach Fortress Europe? So our wars cause excess deaths, our climate change causes excess deaths, and our benefit cuts cause excess deaths. And I feel that if Hunt and the government really cared about this, they'd be addressing it at all times rather than just when it fits with their agenda. And these deaths don't fit with their agenda, because to get away with their attack on our NHS and our welfare state, they have to demonise these groups, and so people on benefits, migrants, refugees, become the scapegoat. So rather than talking about the NHS being overstretched because the government have cut all the services that prevent people from becoming unwell, we talk about it being overstretched because of migrants and refugees. But the NHS is built on immigration, and with our ageing population, we're going to need more and more of it. So we need to get rid of this kind of racist rhetoric, and we need to say that we understand that it's the government and big business that are responsible for the reduction in the living standards of many people, and it's them that are the threat to the society that we want. So seeing the government and the media lie about us has opened our eyes, and we're starting to question how they portray others in the media. At the beginning of this dispute, there was a substantial kind of resistance against talking about the refugee crisis because it wasn't relevant. And kind of as time's gone on, that's changed completely. So in March, we had the BMA banner on the National Stand Up to Racism demo. Last week, we almost unanimously passed a vote saying that we need to lobby the government to accept more refugees. And yesterday, we had a meeting in Manchester to plan a healthcare block on the convoy to Calais. So the success in our dispute has kind of shown us that we can make a difference and we can affect government policy. So I'd like to finish with the question, is socialism possible? And at the moment we live in a world where 62 people have the same wealth as half of the rest of the world, and where some countries profit from the poverty in other countries, and where people are having their cities decimated in imperialistic wars for which we can find billions for, but we don't have the money for healthcare, for education or for housing. So I'd say if it's possible to live in a world like that, then anything's possible. our society is constantly changing, and the kind of the discussions that we've had and the contacts that we've made and the eyes that have been opened through our dispute have kind of laid the foundations for further disputes and for things that we can build on. So I feel like whatever happens in our contract, I know we're not going to stop there because there's so many more fights to be won. And I urge you all to get involved in any struggle, because it's empowering and uplifting, and people need your help. And if you don't do anything, nothing will change. So I'd say yes, socialism is possible, but we have to make it a reality. Thank you.